Right. If you have read and understood considering this surgical pathologist patient, kindly tell me how would you address the issue to the patient?
Uh, First of all, I'll say that I'll discuss the patient about the findings of the pathology. I'll say that it could possibly be malignancy, and
Yes.
that but it is in early stage, and probably surgical treatment would be curative for her.
How would you interpret a patient has adenocarcinoma with melanosis coli? What is melanosis coli?
Melanosis coli, it is a disorder of pigmentation of the wall of the colon, which is often identified during colonoscopy. It is actually a benign condition, and
Okay.
yes, it usually because of chronic laxative use,
Yes.
and
So is it? Yes.
it appears brown because of the brownish because of the lipofuscin-laden macrophages.
What are the common carcinoma of colon?
The most common is adenocarcinoma.
Okay.
We can also
Can you
have
tell me the carcinoma of colon? How would you grade it, considering the criteria TNM classification?
in case of TNM, we have the T0, TIS, and
Is there any
then we
other
have
criteria which can be used for the classification of carcinoma?
yes, we have the Duke's staging.
Yes. Okay. First, tell me
The
about the
Duke's A, B, C, D.
Yes.
In case of A, it is the cancer involves the mucosa and submucosa. In
Yes.
case of B, we have B1, B2. B1 involves the musculus mucosa, but it doesn't penetrate. It doesn't pass through the musculus mucosa, musculus propria, and B2 it passes through the musculus propria. In case of C, we have the lymph node involvement. We have C1, C2. C1 it is limited within the bowel wall with regional involvement, and C2 it penetrates the bowel wall with the regional lymph node involvement, and then D it is distant metastasis.
What are the treatment options that can be offered to the patient?
Treatment options, we have conservative treatment, and
Yes.
also we have the surgical treatment.
Yes.
And also we have chemotherapy and some immunological agents, some biological agents, sorry.
Okay. Can you please define adenoma?
Adenoma, it is a benign epithelial neoplasm of glandular origin or producing glandular patterns of both.
Okay. Can you tell me what are the risk factors for having CA colon?
Yes, certain risk factors are increasing age, male gender, family history of IBD, FAP or HNPCC, some diseases like them, and then certain habits and dietary habits and personal habits like smoking, alcohol, obesity, certain dietary habits like red meat and decrease dietary fiber diets.
Considering the Duke's classification, the modified Duke's classification, can you tell me how would you grade this lesion this patient has? If it
This
is
patient has Duke's B stage.
Okay. What can be the treatment that you'll offer to the patient?
Duke B, usually it's stage 2, so we can go for surgical treatment, surgical resection.
All right. Can you define dysplasia?
Dysplasia, it is a disordered growth of the cells. Is characterized by pleomorphism, but it is limited within the within the.
Can you define the term inflammation?
Inflammation, it is a condition which is
How would you
associated.
differentiate it from cellulitis?
Cellulitis, I remember now. I know, but I can't tell.
Okay, I'll tell you, it's an infection, right? But then if I ask you to compare it with inflammation, then you have to tell me what kind of infection. Cellulitis mostly has streptococcus A, group A,
Yes.
right? So what happens in cellulitis, which may not happen in inflammation? There can happen extensive necrosis in cellulitis, which will not occur in
necrosis,
inflammation.
abscess can have.
Yes. Then if you're talking about abscess, then what is abscess and what is cellulitis? How would you differentiate the two terms?
Cellulitis is
It's diffuse and abscess is limited.
Diffuse. Abscess is a localized collection of pus.
Yes, but it's limited and it's central zone, only central zone of necrosis, whereas in cellulitis there can be extensive necrosis. Right, but in both abscess and cellulitis there could be only streptococcus A. That's all. Yes.
Cellulitis,
Okay.
yes, ma'am.
Yes. Okay, what management can you offer to the patient if patient has cellulitis?
Cellulitis, it depends on the. Usually, it is because of the staph and strepto.
Yes.
Usually, we go for cloxacillin, cloxa or amoxicillin groups of drugs. And in case of inflammation, usually anti-inflammatory drugs.
According to the NICE guidelines, can you explain how colonoscopy is performed?
Colonoscopy, we have to first prepare the patient, ma'am.
Yes, what are the advices that you give to the patient to prepare for the colonoscopy?
There's this 3 days preparation, ma'am.
Yes.
I really can't remember, ma'am.
Yes, you revise that. There you go, but then yeah. Right. If okay, tell me the blood supply of the colon.
The ascending colon and transverse colon, it receives supply and metacolic branches of supramesenteric artery.
Yes.
And the left 1/3 of the transverse colon and the descending colon and the sigmoid colon, rest of the colon is supplied by the left colic artery and sigmoidal arteries from the inframesenteric arteries.